Thank you so much, the Ukraine Media Center, for giving us a great privilege of holding this press conference here. Today we will have 4 people attending, but we have 2 speakers. First will be Minister Viktor Liashko, the Minister for Health for Ukraine, whom I'm sure whom you all know very well. And also speaking next will be Dr. Tedros Adhanom Ghebreyesus, our Director General for the World Health Organization. We have 2 others with us, Dr. Yano Habik, who is the World Health Organization's representative here in Ukraine, and we have Dr. Mike Ryan, who's our Executive Director for Emergencies, and they will be here to provide information and answer your questions. But now, as the Minister is very pressed for time, I will call on Minister Liashko to please make the first intervention.
Yeah. Сьогодні в Україні ми раді вітати генерального директора Всесвітньої організації охорони здоров'я пана Тедроса з його командою. День у нас був сьогодні насичений. Перше, що ми показали жахливі наслідки, які творить російський окупант на території України, обстрілюючи мирні квартали, обстрілюючи цивільні лікарні. Це не можна не помітити чи не можна не помічати. Тому в розмові з генеральним директором я виділив 2 блоки. Перший – це гуманітарний. Україна потребує допомоги сьогодні від міжнародних партнерів. Вона повинна бути направлена як на підмогу медичної сфери, і в медикаментах, і в медичних виробах, і в медичному обладнанні, для того, щоб ми давали належну відповідь на ті виклики, які принесла в нашу країну війна, повномасштабне вторгнення Російської Федерації. Другий блок – це блок політичний, оскільки зупинити війну можна тільки максимум тиснувши на Російську Федерацію. Україна переможе. Наші Збройні сили України роблять неймовірне, захищаючи територіальну цілісність нашої держави. Тому в мене прохання до Всесвітньої організації охорони здоров'я сьогодні проявити лідерство, об'єднатися з Червоним Хрестом, об'єднатися з лікарями без кордонів і забезпечити належний рівень або контроль за належним рівнем надання медичної допомоги військовополоненим українцям, які, захищаючи свою державу, можливо, сьогодні не отримують належного рівня медичної допомоги. На жаль, українським медикам дозволу російські окупанти не дають. Тому саме міжнародні організації повинні стати тим драйвером і врятувати українців, які нічого не роблять, вони нічого не вимагають, вони просто роблять те, що повинні зробити кожен із українців – захистити свою державу, захистити свої родини. Другий блок питань політичного характеру – це питання доцільності функціонування Офісу неінфекційних хвороб в Всесвітньої організації охорони здоров'я в Москві, оскільки не може країна однією рукою вбивати, другою рукою показувати, що вона турбується за профілактику і збереження життя цілого світу через Всесвітню організацію охорони здоров'я. Ми на 10 травня на регіональному комітеті Європейського регіонального бюро ВОЗ, а потім і з 22-го на асамблеї Всесвітньої організації охорони здоров'я будемо розглядати ці питання. І я прошу підтримки в колег в тому, щоб ми це зробили. Так як і зробили, можливо, політичний тиск і виключили представників Російської Федерації з виконавчого комітету Всесвітньої організації охорони здоров'я. Повинні всі в Росії зрозуміти, що Україна – демократична, вільна держава, яка бореться і захищає свою свободу. І, на жаль, ми захищаємо його, втрачаючи життя наших громадян, в тому числі і медичних працівників. З часів війни загинуло 10 моїх колег, більше 40 поранено, зруйновано 40 лікарень, які вже не підлягають відновленню. Сьогодні ми були в одній із таких. Близько 500 лікарень пошкоджено, в яких не можна надавати медичну допомогу. Все це порушує девіз Всесвітньої організації охорони здоров'я – здоров'я для всіх. І, на жаль, ми сьогодні не можемо це забезпечити, тому що там ідуть бойові дії, там небезпечно не тільки для надання профілактичних послуг і лікування, там небезпечно для всіх українців через те, що Російська Федерація, порушуючи всі Женевські конвенції і міжнародне право, використовує заборонену зброю, яка призводить до руйнувань. Тому я, як міністр охорони здоров'я, прошу всіх, хто опікується гуманітарними сферами, включити по максимуму своїх політичних можливостей і зробити все можливе, а можливо і неможливе, для того, щоб зупинити війну в Україні, за того, щоб Російська Федерація повернулась і вийшла з території незалежної, вільної, демократичної України. Дякую за увагу.
Minister Liashko, and now I'll call upon Dr. Tedros Adhanom Ghebreyesus, the World Health Organization Director General, to make his remarks about his visit here in Ukraine.
Your Excellency, Minister Viktor Liashko, members of the media, good evening, and thank you all for joining us this evening. I have spent the last 2 days in Ukraine and have been deeply moved by what I have seen and what I have heard. I have also had the honor of meeting with Prime Minister Shimhal, Deputy Minister of Foreign Affairs Zaparova, and others. We discussed the health situation in Ukraine and how WHO can best support the Ministry of Health to deliver care in conflict areas, as well as to sustain care for those who need it throughout Ukraine. My time here has affected me very personally. As someone, myself, who grew up in a war zone, I understand only too well how the people of Ukraine feel. The worry for family and friends, the fear, the sense of loss, and so on. Because I know the impact, I know the devastation of war firsthand. And I felt very, very sad when Russia invaded Ukraine, because I know its impact and devastation. However, I have seen extraordinary resilience, people who have suffered loss and destruction but have not given up. They have kept going, repairing essential services to stop that destruction, making a deeper hole in their lives. I have seen the damage inflicted on health structures and listened to accounts of the harm, physical and mental, inflicted on health workers. These are people whose primary motivation is to protect health and life. WHO has now verified 200 attacks on healthcare in Ukraine since the war began. These attacks must stop. Healthcare is never a target. While I saw and learned of great suffering, I also saw bravery, humor, kindness, and heard stories of spontaneous, often ingenious ways people have found to help and protect one another. Some of those I'm talking about are our own WHO staff, who, although they have lost their homes, fear for their families, deal with daily uncertainty, have kept working to support the health needs of the people of Ukraine. Our team in Ukraine was working hard to support the country to build an ever stronger health system before the war. And that work will continue. Since Russia invaded Ukraine, WHO has delivered trauma and emergency supplies for use in over 15,000 surgeries and enough medicines and healthcare equipment to serve 650,000 people. We have also provided 15 diesel generators to provide electricity to hospitals and health facilities, some in the newly accessible areas in Kyiv Oblast, which I just visited this afternoon. And we are handing over 20 ambulances tomorrow. WHO has also supported or coordinated more than 50 emergency medical teams in Ukraine and neighboring countries hosting refugees. And in past months, we have trained thousands of Ukrainian healthcare providers on how to handle mass casualties. This includes training on hospital blood transfusions in conflict settings, traumatic limb injuries, emergency nursing care, and essential burns care. We have also established 3 health hubs in Western Ukraine to support medical evacuations and ensured safe medical evacuation of patients, including those suffering from cancer, for treatment outside Ukraine. These are just a few examples of the work we are doing. I have been very moved by the resilience of the Ukrainian people, the bravery of Ukraine's health workers, the dedication of our own WHO staff, and the commitment of the Ministry of Health under his leadership and the government of Ukraine to protecting health in these terrible circumstances. My message to all the people of Ukraine is that WHO stands with you. We will do everything we can to support the government in its efforts to treat the injured, maintain health services, and to repair and strengthen Ukraine's health systems. But there is one medicine that WHO cannot deliver, and which Ukraine needs more than any other, and that is peace. So we continue to call on the Russian Federation to stop this war. Thank you. Dziękuję.
Thank you, Dr. Tedros. I'll now open the floor to questions. As I should remind you, both speakers are very pressed for time, so we will not be able to ask many questions, but please give your name, your media outlet, and please indicate who your question is to. I'm looking at the floor now. I can see
Якщо можна, пані Маргарет.
If possible, Margaret, now we will start with Ukrinform, Ukrainian National News Agency. We have 2 questions for Director General, and the questions are as follows. How WHO handles the issue of catastrophe in those occupied territories, the shortage of medicines, shortage of medical staff, and how the WHO responds to the needs of Ukrainians in the occupied areas, occupied by Russians?
Maybe better answered by Dr. Habicht, I think, because that's very specific.
Thank you for the question. What WHO has been doing in more than 70 days as the war has been going on in Ukraine has asked the corridors to ensure that the humanitarian corridors to Luhansk, to Donetsk, as well as now to Mariupol, many other places, to ensure that the humanitarian goods, including medicines, and the trauma kits and others that the healthcare workers need are reaching to those places. There are convoys, UN humanitarian convoys, multi-agency, that have reached to Sumy and some places where also now access is available. So we ask the corridors to ensure that the civilians have the support. In the past week, together with many, including the UN and ICRC, we have been with our team in the field in Zaporozhye, part of the evacuation from Mariupol. And this is very practical what we do to ensure that those who are able to move can get quick care and support from mental health to any other treatment that they need. And our team is there, and we continue to do that. So humanitarian corridors and those who are evacuated, to provide them the essential care as soon as possible. Thank you.
Thank you, Dr. Habib. The next question.
Hi there. I'm Bardi Afshin from Volent Media, Iran International, Dr. Tedros, Dr. Ryan, Dr. Hayes. It's good to see you after 2 years, which hasn't been really easy for you. And I do appreciate you did put your heart and soul to tackle a world pandemic. My question is, would you consider targeting healthcare facilities an act of war, a war crime?
Thank you. I think this might be one for Dr. Ryan to answer.
Good evening, everyone. Dr. Mike Ryan. Yes, intentional attacks on healthcare facilities are a breach of international humanitarian law, and as such, based on investigation and attribution of the attack, represent war crimes in any situation. We've seen, as the Director General has outlined, verified over 200 attacks on healthcare here in Ukraine. That is what we've been able to verify. That does not represent the totality of that. Under the Resolution 2286 of the United Nations General Assembly, WHO is tasked with documenting and verifying those events, and it is then the job of the Secretary General's Office and the International Criminal Court and others to investigate the criminal aspects of those attacks. Attacks on healthcare in the context of Ukraine and in so many other contexts, from a WHO perspective, when those attacks are intentional, when those attacks are used as a part of the tactic of war to terrorize communities, to take away hope that people have for the future, that is the essential objective in these situations. And it is very clear in international law that it is not only the responsibility of conflicting parties not to attack healthcare facilities, but to deliberately not target them. So this discussion we have around collateral damage or accidents, we have to ask our questions: how many accidents can you have before you are in a situation where it is completely and utterly unacceptable? And the Director General has said this on so many occasions. Utterly unacceptable to deliberately target healthcare facilities and the health workers that are in there, the patients that are in there. So from WHO's perspective, we continue to document and bear witness to these attacks. We will continue to publish on these attacks, and we understand and we trust that the UN system and the International Criminal Court and others will take up the necessary investigations in order to assess the criminal intent behind these attacks.
Thank you, Dr. Ryan. The next question in the room. It looks like everybody's satisfied. This may be a good time. I think the Minister would like to go, so I'm going to just ask the Minister and Dr. Tedros if they've got any final remarks. No, so I'm going to say thank you very much to all of you, and again to the Media Centre and Olga for your warm welcome, and really appreciate the time here, and thank you very much. We will make all the materials available in due course. Thank you very much.